My name is Skylar Lockley, and I did my research project on opioid abuse. What are opioids? Opioids are a class of drugs that include the illegal drug heroin, synthetic opioids such as phenytoin, and pain relievers available legally by prescription such as oxycodone, hydrocodone, codeine, morphine, and many others. These drugs are chemically related and interact with the opioid receptors on the nerve cells in the body and the brain. Tell me more about opioids. Opioid pain relievers are usually fine taken over a short period of time as prescribed by the doctor. In addition to pain relief, opioids produce euphoria. The euphoria produced can lead to misuse of drugs. And euphoria is like the high that users get when they're on drugs or whatever, and that causes them to become addicted to them. How similar are opioids and heroin? And this is oxycodone, and this is heroin. This is the chemical makeups of, and you can see how closely related they are. Because prescription opioids are similar to and act on the same brain systems affected by heroin and morphine, they present an abuse and addiction liability, particularly if they are used for non-medical purposes. And opioids are so easy to get addicted to. It's the same as the use of heroin though, and opioids destroy families, and people should really avoid using opioids too much, and pharmacists should really cut down on the amount of prescriptions they write for people, and they should keep notes of how many times they've wrote out prescriptions to this person, because in statistics they've showed in the United States that there has been so many prescriptions wrote for opioids that the statistics show that they wrote so many that there's been enough prescriptions wrote that each person in America should have a full bottle of opioids. So that is a really high number of prescriptions wrote for opioids. What happens when opioids are misused? Opioid misuse can lead to drug overdose incidents and even death. An opioid overdose can be reversed with the drug naloxone when given right way. Since 2007, overdose deaths related to heroin have been increasing. Opioid abuse. Between 1997 and 2006, retail sales of opioids have increased dramatically. Sales of hydrocodone increased by 244%, oxycodone by 732%, and methadone by 1,177%. One study reported that healthcare costs for opioid abusers were 8 times higher than for non-abusers, with an average per person cost of $15,884 to pay for abusers compared to the $1,830 for non-abusers. Opioid prescriptions dispensed by U.S. retail pharmacies, and this goes back to what I was just speaking about a while ago. The total number of opioid pain relievers prescribed in the United States has skyrocketed in the past 25 years. You can see here on the chart how it's just gradually increased on here. The blue is the total, the red is hydrocodone, and the green is oxycodone. The number of prescriptions for opioids have escalated from around 76 million in 1991 to nearly 207 million in 2013. The U.S. is their biggest consumer globally, accounting for almost 100% of the world total for hydrocodone and 81% for oxycodone. How can opioid abuse be prevented? We should learn to educate providers as well as the patients. They should be aware of the hazards that come with taking opioids. Prescription monitoring programs. We should always monitor how many prescriptions are being wrote to each person. Preventing prescriptions and medical errors. Pharmacists should always review the prescription as well as reviewing the people that are giving it to make sure it's the right patient. Checking patient identification at the pharmacy, which is what I just covered. Referral to pain specialists. And if they feel like people are becoming doctor shoppers, they should always refer them to specialists so they can get help before it becomes an addiction and becomes hazardous to them. The use of abuse deterrent opioid formulations. What are the signs of opioid abuse? Noticeable elation and euphoria, confusion, constricted pupils, slow breathing, intermittent nodding off or loss of consciousness, constipation, doctor shopping, shifting or dramatically changing moods, social withdrawal, isolation. Um, Most of the time, opioid abusers is pretty well self-diagnosed, but a lot of times opioid abusers are not really going to get help for themselves. So it's important for family members to keep note if they notice any kind of changes within their family members, so they can go ahead and get them help before it becomes hazardous to them and could even result in death. Withdrawal symptoms. The signs of withdrawal mimic the symptoms of a flu: headache, nausea, vomiting, diarrhea, sweating, fatigue, and anxiety, and inability to sleep. Withdrawal is one of the treatments that people are given when they're trying to, one of the symptoms that happens when doctors and specialists are trying to wean them off of opioids, and it can mimic the same thing as a flu. How to treat opioid addiction. Medication should be combined with behavioral counseling for a whole patient approach known as medication-assisted treatment. MAT decreases opioid use, opioid-related overdose deaths, criminal activity, and infectious disease transmission. MAT increases social functioning and retention in treatment. And this is my resources. Thank you for viewing my presentation on opioid abuse.